Family planning and what it can achieve has been well computed by UNFPA, a global organization that delivers contraceptives at the community level.
We can prevent 54 million unintended pregnancies. We can also prevent 26 million abortions.
Reduce 79,000 maternal deaths as well as 1.1 million infant deaths. Great things it can do. However, for some women in Ayako village, Petasab County in Tororo district in eastern Uganda, it is not what it is purported to be.
After 3 months, I go and they inject me. I don't know how they call that method.
It is called injectables, and according to the Uganda Demographic Health Survey, it is the most preferred choice of modern contraceptives by many women. It is mainly known as Injectaplan or Depo-Provera.
There are side effects, like any other hormonal method that I expected. A mother may have headache, some may put on some weight, some may have prolonged bleeding, others may have bleeding on and off. Okay? But these things are not supposed to scare the client.
Well, 10 years later, and they are scaring Agnes of family planning.
Started feeling some wounds from my stomach here up to here where I urinate even.
She says that this doesn't permit her to engage in sexual intercourse with her man.
If you can marry another wife, let him go and marry.
Agnes is saddened by this fact, and efforts to get medication have proved futile.
I've spent a lot of money, even recently. I sold one of my goats.
She now says that quite a number of women in her village are going through the same ordeal. UHMG's family planning specialist, Dr. Margaret Elang, says some women are not meant to use some hormonal methods.
Now with the pills, there are also other specific ones that a breastfeeding mother should take and others that any other woman can take. If you've ever suffered from a liver disease, epilepsy, if you have unmanaged hypertension, when you have lumps in your breast, there are also certain ARV drugs that a service provider is supposed to tell you whether they would work properly with the family with the hormonal method.
However, service providers are supposed to tell the women about side effects pertaining to all methods.
Family planning is about voluntarism, it's about choice, no coercion.
Agnes is disturbed by the women who don't believe her story of using these methods. She is frustrated and determined to run a smear campaign against family planning, especially the Injectaplan, which is a widely used method here in Uganda.
City marriage stops. He came at the sub-county. Women, he went there, a lot of them. So I try my level best to stop them, but still they go.
31-year-old Mary Atieno is equally frustrated.
She started gaining weight. She was tiny, but from there, that within that very year, she started gaining weight.
Actually, in a year, it may add about 0.5 kilos.
Sometimes, side effects do persist, like prolonged and heavy bleeding.
When you're using any family planning method, it does not stop you from getting any other illness. So if somebody is using a family planning method and probably gets low abdominal pains, or they have a backache with discharge, or any of that, they're supposed to go back to the facility for evaluation.
Non-hormonal methods like the intrauterine device, cervical cap and diaphragm have less severe effects. However, women who have unexplained bleeding are not advised to use this type of method. Florence Asio has complaints similar to both women, but unlike Agnes, her campaign against family planning is proving successful because she has managed to dissuade some women.
They taught us about natural family planning.
She has got this education from Human Life International. The director, Father Jonathan Opio, is against modern contraceptives.
We discovered through training and research that the natural family planning is the best method.
Yes, it is the best because there are no medical side effects according to WHO. However, it is also the least effective method with high failure rates.
3 and some go up to 9 per 100 women, meaning 9 women out of 100 may get pregnant.
Natural methods including withdrawal and fertility awareness require partner cooperation, which doesn't work out so much for many women.
You know, these drunkard men, if they come from their bus, some can force you that we don't.
In a global meeting of Women Deliver, experts on family planning had high hopes in religious leaders as advocates for contraceptives usage.
You know, in Senegal, I met with the Muslim leadership and I met with imams all the way from the top down to the village level. And what was so encouraging for me to hear from them was the Quran allows for family planning. We need to help you get the word out, but that has to be driven at the country level.
Some leaders who are, however, against the modern contraceptives are slowing the progress of the benefits that come with family planning.
I'm just telling the government to stop them from giving our women this family planning.
And Uganda's Minister of Health says it will not stand by and watch some individuals or organizations preach against any family planning method.
In the pretext of being religious messages which are counteracting our messages. So we need to continue all the time to make sure that people get the right information and they choose from an informed perspective.
About 4 out of every 10 women using family planning in Uganda discontinue use of a method within 12 months of starting its use. Fear of side effects is the main reason for discontinuation at 16%, with the pill having the highest discontinuation rate at 54%.
Once you have decided that you'll be taking it at 8 p.m., you take it at 8 p.m. Ideally, as you're going to bed and after you've had a meal. Okay? And this is mainly to minimize on the side effects. Some causes of cancer are not known, but for cervical cancer, for example, cancer of the cervix, that is known, there's a virus that causes it. So women should not be deceived out there that it's family planning causing cancer. In fact, DIPO has been proved to reduce instances of endometrial cancer.
Uganda currently is one of the countries with one of the highest population growth rates in the world each year, at almost 3.5%. The Minister of Health believes that this explosion will continue to affect the women and children's health in a country where resources are not enough for everyone. They insist that the more women and men are open to family planning methods, the better. Florence Nalimba, NTV.